How to understand your fertility hormone levels. Understanding your fertility hormone levels can seem complex, but it's a key step in figuring out your reproductive health. Think of hormones as messengers that tell your body what to do during each phase of your cycle. Knowing how they fluctuate and what they mean can help you understand your fertility better. It's especially important if you have conditions like endometriosis, which can affect hormone balance and fertility. Let's start with the main hormones involved. Luteinizing hormone is a big one. It surges mid-cycle, usually around day 12 to 16 in a typical 28-day cycle, triggering ovulation, the releases of an egg. Tracking this surge helps identify your most fertile days. Then there's follicle-stimulating hormone, which stimulates the growth of ovarian follicles early in your cycle. If FSH levels are high, it might suggest your ovaries are not functioning optimally, possibly indicating diminished ovarian reserve. Estradiol, a form of estrogen, is produced by developing follicles and helps prepare the uterine lining for pregnancy. It also regulates FSH and LH levels. Progesterone is produced after ovulation by the corpus luteum and supports the uterine lining to help sustain a pregnancy if fertilization occurs. Another important hormone is anti-Mullerian hormone. Unlike the others, AM levels stay relatively stable throughout your cycle and reflected your remaining egg supply. Low AM can suggest a reduced ovarian reserve, which is common in women with endometriosis. Understanding how these hormones relate to fertility is crucial. Endometriosis can interfere with hormone regulation, leading to irregular cycles, abnormal LH or progesterone levels, and sometimes anovulation, where no egg is released. Hormone testing can reveal these issues and help your healthcare provider develop a personalized plan for treatment or management. To understand your hormone levels, there are two main methods. The most reliable is clinical blood testing. These tests are done on specific days of your cycle, like FSH on day 3 or progesterone about a week after ovulation, and analyzed in a lab. They give precise measurements that your doctor can interpret. The other option is at-home fertility tests, which usually measure urinary LH surges to predict ovulation. Some also measure progesterone metabolites or estradiol. While these are convenient and often quite accurate, their reliability can vary depending on timing, test quality, and individual hormone fluctuations. They're helpful for initial insights but should not replace professional testing. Emerging technologies are working toward home blood testing devices that can measure hormones like estradiol more accurately. These could make monitoring easier and more precise in the future, but for now, clinical testing remains the gold standard. Interpreting your hormone levels involves understanding that they naturally fluctuate during your cycle. A single measurement provides limited information. It's best to look at patterns over time and, in conjunction with symptoms and ultrasound findings. Abnormal levels might point to issues like anovulation, hormonal imbalances, or diminished ovarian reserve, especially in women with endometriosis. If you suspect fertility issues or have endometriosis, it's essential to consult a healthcare provider. They can order the appropriate tests, interpret the results, and guide you through options tailored to your situation. Remember, hormone levels are just one piece of the puzzle. Imaging and other assessments may also be necessary for a complete picture. In summary, understanding your fertility hormone levels involves knowing which hormones are key, when and how to test them, and working with medical professionals for interpretation. While at-home tests can be helpful, they are best used as part of a broader evaluation. Always seek personalized advice because every individual's hormonal balance and fertility journey are unique. With the right information and support, you can better understand your body and take informed steps toward your reproductive goals.